guys, so I decided to make this video because I get a lot of questions about like being a surgical tech. So being a surgical tech, it is a 2-year degree. After you graduate with your associates, you do have to take like an exam to work as a surgical tech. The program basically focuses on like sutures, instruments, anticipating what the surgeon may need next. What are the instruments needed for, like the categories of instruments. Math is one of the requirements. Math and like a college math and a college English, and anatomy, physiology 1 and 2, and microbiology was one of the recommendations for the program that I attended. I do know that in Phoenix, Arizona, actually Mesa, Arizona, there is a 9-month program. I'm not sure what the requirements is, but it's not as long. But the program basically prepares you to be able to practice sterile technique, to know your instruments, to know your sutures, and be able to assist the surgeon. You guys asked about pay rates. So pay rates, they vary. I've had like 5 different interviews, and the pay rates have varied from $22 an hour to $30 an hour. And with the median was like $26 an hour. It all depends. So the lower rates was like mainly like surgery centers, and then the higher pay rates was normally like hospitals and stuff. It just depends what area you want to go into. Also, people ask like, is surgical techs medical assistants or are we nurses? No, we're just surgical techs. We're in our own little field. Like we only can do what surgical techs do. Which is assist the surgeon. We're medical assistants. I don't know, maybe they do like billing and stuff. And then nurses, they do whatever they do. But a lot of surgical techs do go back to school, like to become registered nurses, and like so that they can grow up on the ladder. Because once you're a surgical tech, that's all you can practice is your sterile technique and assist your surgeon. What else?